Set yourself up for success by becoming an informed consumer on the process of therapy. Hi, I'm Michael Ceely, and here are the 6 essential elements of psychotherapy. Now, I say essential because in my work in psychotherapy, I've noticed there are, in my opinion, 6 necessary things that have to really happen to make therapy worth your time and money. And if these are not happening, it's not going to be effective for you. But before we dive in, I just want to say that part of this process is getting the right therapist fit for you. And I would recommend that you talk to a couple of therapists at least before you decide on someone. And you can do that by talking to them on the phone. Most therapists offer a free phone consultation. Ask questions to your potential therapist. See if it's a good fit before you dive right in. Okay, element number 1, the first thing that absolutely needs to happen in psychotherapy to make it effective for you and make sure this happens is assessment. Now, obviously, a therapist is assessing you all along during therapy. What I'm talking about is what's called the initial assessment. This is like a health history, things that a doctor might ask you. So a therapist hopefully should be asking you about any health issues you might have, medications you take, if you have a history of substance use, things like that if you've been in therapy before. And these, of course, are personal questions, and it's kind of hard to answer some of these maybe on the first session. But a good therapist will ask these questions because you need to have a good fit with the client. For example, if you don't specialize, if you're a therapist and you do not specialize in substance use treatment, and you forget to ask the client, hey, how much do you drink, etc., and on like the 3rd, 4th, or 5th session, you find out that the client has a big problem with alcohol, you've now wasted that client's time and money because you're not a specialist in substance abuse treatment. Maybe that client would be better served with a therapist who specializes in substance abuse issues. So it's very important that the therapist does an assessment. This should be happening during the first session. Definitely by the 2nd or 3rd session, they should have almost all of your health information and history. So look for that assessment going on. If it's not happening, that is a red flag. Okay, number 2, the second thing that must happen, in my opinion, for therapy to be effective is the therapist has to define the problem with you. This may seem obvious, but it's important to define the problem. You'd be surprised at the number of clients who I talk to who've been in therapy in the past and the problem wasn't really defined. So for example, if you're feeling anxiety or unhappiness or something that I would call a symptom, that may not necessarily be the problem. The problem is deeper than that. There's something causing that symptom. So the therapist and the client, they need to have a conversation and define, okay, what are we here for? What is the actual problem? This is what we need to work on. So make sure that that happens very, very soon in therapy, that you're talking specifically about what the issue is. It may take sometimes to uncover that. That's okay. But there needs to be a conversation right away about what the problem is. There shouldn't be just diving right into conversation without any guidance. There needs to be a definition of the problem. The third element, okay, so the number 3 thing that needs to happen for effective psychotherapy is setting goals. Similar to defining the problem, you need to set the goal. What is the goal? What is the outcome of therapy? When will you know when you're done with therapy? This is what we call a goal. Now, it doesn't mean that you can't change your goals during therapy, but you need to start with a goal, at least in pencil, something that you're shooting for, a target you have for you and your therapist to work on. So say, for example, someone has high anxiety during public speaking. This is very common. Now, I would say that the goal wouldn't be to get completely non-anxious, to never ever feel anxious about public speaking. Again, that's not realistic. There's nobody I know that isn't at least a little keyed up before public speaking. So you need to have a measurable, observable criteria set up for what your goal is. Like, how are you going to measure that? And it could be, let's say that I will feel okay leaving therapy if I reduce my anxiety symptoms subjectively by 50%. It's right here, right now. If I reduce it by half, I'll feel pretty good about my public speaking. It may be a little painful, but I'll get through it and I won't have to be in therapy. that is a good goal. If you're not talking about goals with your therapist, or they're not bringing it up, or it's not clearly defined, that is also a red flag, and you want to at least push for that with your therapist. Or if they're not working with you on this, you can always find another therapist. Okay, element number 4, the fourth thing that needs to happen for effective psychotherapy, is measuring your change. Similar to setting goals that have an objective value to it, the therapist should be asking you on a very regular basis, hey, how's it going? How is the change going? Now, there could be a subjective report from the client. That's good. You can even take it a step further and ask the client to subjectively rate on a 0 to 10 scale how things are going. Getting some sort of objective measurement is good, but the therapist needs to be tracking the behavioral change. Now, that could be assignments to you where you track it and report back to the therapist, but if there's not a conversation about how you're progressing in just your actual behavioral change, not how it felt or not how are you feeling about therapy, but like, are you seeing change in the real world? So that's another thing that needs to be happening. You need to be measuring your change. Number 5, the fifth element, is practicing new skills. It's great to talk about behavioral change, but you need to actually practice. You need to try some of these things out in the real world, and hopefully your therapist is going to push you to do some homework or something that's going to help you practice your new skills. Let's take again the example of public speaking. The therapist can even help you during session do some public speaking, and you can get some feedback from the therapist. You're in a safe environment. You can take some risks and really start leaning into some of that nervousness. Another example might be assertiveness. Let's say that the client has an issue with being assertive with their coworkers or boss. This can be practiced during session. It could be practiced out in the real world as homework, but there needs to be, in my opinion, an essential element of therapy, which is practicing some of these new skills so that you can actually apply it in the real world, not just talk about it, during therapy in the office or online. And finally, number 6, the sixth element that needs to happen in effective psychotherapy is graduating from therapy appropriately. And I say graduating because it's akin to graduating from a program, graduating from school, meaning that the curriculum is complete, you have achieved your goal, you've done the work, there is validation in the work, there's an agreement that, okay, we've met goals, it's time to move on. So this has to be happening in therapy. There needs to be a conversation, hopefully started by the therapist, about, hey, how will we know when it's time for you to quit, right? Because it has to end at some point. You don't want to be perpetually in therapy. There may be some instances where there's an agreement where you simply visit your therapist on a regular basis, but that has to be an agreement. Up front, there needs to be discussion about what happens when you meet your goals. Do we stop therapy? Do we go to once a month? Once every 6 months, or whatever. But the point here is there needs to be a termination discussion. And if that's not brought up by the therapist, that's not a good sign, because you may not know when it is time to leave therapy, right? And it can be a difficult conversation because there can be a bond between the therapist and the client, and both of them may feel uncomfortable ending therapy, right? But that needs to be discussed. So if your therapist isn't bringing up that topic, probably actually pretty soon in the therapy process, you may want to ask them, hey, how will I know when I'm done? What is the plan for that? Do you taper off? Like, how does it work? So that's important to talk about. Again, if the therapist isn't bringing it up, you can ask and find out how therapy can end effectively and appropriately so that you feel good about all the work that you've done. So that is it. It's the 6, I think, essential things that have to happen during therapy. There are a lot of great things that can happen during therapy, but this, in my experience, I've boiled it down to 6 things that at least I could think of that really need to happen for you to get your money's worth, to feel good and have a great therapy experience, okay? So I hope this helps you. You can watch this video again, remind yourself as you're looking for a therapist, or send this to your friends and say, hey, here's some effective things that can happen in psychotherapy. And this is, by the way, based on cognitive behavioral therapy. It's what I do, and it is very goal-oriented and based on a lot of feedback and measurements. Now, there's other styles of therapy, which is great, but at least you want to be having the conversation with your therapist about how does it end, how do I know if I'm making progress, etc. I think is very important to find that stuff out, okay? Good luck out there. Therapy can be a great experience if it's done properly and has the essential elements in it. Thanks for watching.